Rock Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to Fight Against COVID-19. I'm your host, Dr. SHEFALI AGARWAL. Thank you for liking and subscribing to our show, and thank you for supporting our show. With this show, we were able to bring many people up front, people who are working behind the scene or in front line, people who are either making masks, supporting people who are hungry, small businesses, and many more. We have many people in frontline who have come, doctors, nurses. Today I have a special guest who's a nurse in Rhode Island, and I'm very excited to talk to her about her experience about COVID-19. So I would like to invite Rama Subramaniam from Rhode Island. Welcome, Rama.
Hi everyone.
So, Rama, thank you for coming on the show and talking about your experience. Before we start about COVID-19, tell me a little bit about yourself and your family.
Um, I am Rama Subramanian and I'm an oncology nurse and I work in Rhode Hospital Lifespan Cancer Institute and I've been in US for more than like almost 12, 13 years and I have two daughters and one is 15 years old and another one is 10 years. One is in high school and the other one is in fifth grade and they're doing great and they both and my husband works in electric board and that's it. And then that's about my personal. And coming to my professional, I'm an oncology nurse, work in Rural Hospital Lifespan Cancer Institute, and my primary responsibility is to give chemo infusions to the cancer patients. So I work with hematology oncology doctors, and I'm primarily like the primary nurse for them. So I'll be traveling with them since the diagnosis till through their treatments. So I'll be in all phases from the diagnosis, from the once they recover, and like the whole journey. That's
So
my
tell me a little bit. Tell me a little bit about your experience about COVID. Like, what is your experience in terms of COVID and patients and things like that?
yes, COVID. So this is really a terrible situation now everyone is facing. So this pandemic, and mostly the healthcare workers are the front line, are the truly front line in this situation. And this pandemic has brought so much fear and uncertainty for everyone. So especially for the nurses, now the challenge is a bit more.
Yeah.
It's not only in the working area; it's not also to the families, where they go back to the family. So, so we are basically mostly the chemo patients, but we also get patients because everyone is exposed. So there are
Yeah.
risks for patients coming to our clinic for COVID. So I know it's just started very worse, like the beginning of the March is started, like the second week of March is like it was like in a peak. So we have to be very careful in bringing patients to our clinic because our patients are more immunocompromised and they are more vulnerable or more risk. They are in the high risk category to get the COVID. So we have to be very careful. So initially, what we did is because there are so many rules were changing because they keep changing the policies. So initially, like they said that if there, anybody is exposed to any families or persons exposed to COVID, not to come into the clinic or any symptoms. So initially, it'll be screening. So it's an outpatient. I'll be giving chemo, so we have to screen the patient. So
Yeah.
we have to call them. So the day before, we'll be calling the patients and ask questions. Okay, do you have any symptoms? And the patient get panic,
Mm-hmm.
because they have to come for treatment. That's really
Sure.
sad. And then we have to like, okay, we'll be calling them. So do you have any symptoms? Do you have any exposures? And then we get all the information. And also before coming to the clinic, we have to call them. Then this we even we call them the day before or on the day during the day of the infusion. So we will screen in the beginning, like in the front desk before coming to the clinic. So we've been doing that. And then if there is any exposures, we will not allow them to the clinic because we are scared that they are going to infect our very sick
Sure.
patients. So we have a lot of neutropenic patients, because the neutropenic means that their WBC counts are very low. They are very risk for infection. And then later, these patients, we cannot keep postponing their treatments because they need to come for
So
the
it's a
treatments. If
big
you don't
challenge.
treat, yeah, if you don't treat them, then their disease will progress. So then we made like, okay, we are treating even if they have like if they're asymptomatic, okay, so we will be calling them and everybody see, for example, a lung cancer patient, they have cough. So we don't know the cough is from that or
Yeah,
from this.
it's tough.
So that
Yeah.
is a little bit challenge. So we'll be chronic. And then what we did the next time is, okay, we'll bring the patient. If the patient is actively getting treatment, then we will test them for COVID, and then we will separate them from normal patient. That means like, without no symptoms or without like, they'll call like a PUI, like person under investigations. If any suspicious or if we are thinking that they'll be risk for COVID, then we will separate the patients from the normal patients and the risk patients, and then we'll put them in a different, separate room. So, and then we'll follow the, the PPEs and all those things, and we'll test them. So initially it was like a little bit because we're not testing everybody because of we didn't have like more test kits not available, and then later after I think the second week we had a lot of kits, so we started testing everybody, and we treated. And I work. I forgot to tell you, like I work in other hospital. It's a Roger William Hospital, and I'm a per diem nurse over there. So I'm like a float. So I'll go everywhere. So when the situation started in the March, so they like the staffing also, because like they have to put more staffing for screening, and then they have to separate the staff for taking care of normal patients and the corona patients. So I was there in the screening, because they float. So 2 times I was in the ED screening patients, and we
So what
also
did you
screen.
do there, Rama, like when you did screening?
So we ask questions like we take temperature and we ask the symptoms like coughing, any fever initially, and then later they discuss, because initially they didn't add the diarrhea and then the loss of like the taste or smell. If they don't identify that smell, if they cannot recognize the smell, they added, because those are also they added a little bit later initially. So that's why like all the symptoms they've been keep changing, but and then we have to ask all the symptoms, any cough, fever,
So
diarrhea.
did you see people who are like, nervous anyway and they have just sore throat and they get nervous and want to come there and talk to you and say they want to
Yeah,
get screened?
yes.
Yeah.
The thing is, especially, and also, as I said, I'm an infusion nurse, so we prioritize like patients need for chemo treatment or patients getting monthly treatments, we allow them. And there are some patients getting iron infusions and some like monthly IVIG, some just for B12 shots. So for those patients, we'll call them, we tell them maybe you don't need to come, like if you want to. And then there'll be some of the patients will be calling, I don't want to come to the hospitals.
Yeah.
I don't want
That
to come
scare,
there and
that
get sick.
nervousness. Yeah.
And that is really, and as a nurse, and you have to talk to them and you have to let the doctor know. And because even like the middle of the March, like we are like not sunshine, like we were like we are not many information, like we didn't have much information, so we don't know what's like when this will over. Still we don't know when this will over. So it was kind of like more uncertainty, a lot of things we don't have answers, so, but we
And
have to tell them.
as you know, in cancer, it's very difficult because you need to get treatment. It's a life-threatening disease, but then also patients are scared to get infections because they have these neutropenias and things like that.
So
Yeah.
yeah,
Go
we
ahead.
have to reassure them, because the
Hmm.
thing is we are following all the policies and protocols. We are
Yeah.
screening everybody. We make sure that we are segregating the patients with with
Hmm.
suspicion for corona, or with like normal patients we treat them. So
Hmm.
we have to. The trust is very important, because being a nurse, like they trust you. So and then the way you have to like explain that, okay, because the treatment is important for you. So that is important. The treatment is important for you. The risk is getting treatment is that is very important. Or if you see the balance, like if you see which is important, not coming to the hospital
The
or getting.
risk-benefit balance. Yeah.
Yeah, so you have to come for the treatments. I know you're worried of getting the corona, but we are following, because. And the other thing is in cleaning things, cleaning the wiping the chairs, we took like more extra precaution, double,
Sure.
like
Yeah.
those are things we tell the patients that we are taking extraordinary precautions, and we are screening, so you'll be like this is important, your treatment is important. And then they'll be like, yeah, the patient started coming, but you have to bring that trust, or
So
yeah, the patient.
are you scared? Like I'm sure, like what do you feel when you're going to clinic and you have to, take care of these
Yeah.
patients?
So yeah, so honestly speaking, everyone said as I'm a normal person too,
Sure.
and I'm a
Yeah.
nurse, but when somebody's asking, I bring the smile in my face and I tell them, but I
That's
have to say
amazing.
it's. And but sometimes you feel like okay, you're going. And when you hear all the news in the New York and in Massachusetts, when you see all the videos, like nurses getting, And when you see all those things, sometimes you
It
feel
impacts you,
bad.
of course. Yeah.
Yeah, but I'm a nurse. My responsibility is to take care of the sick patients.
That's amazing. Yeah.
It goes off. But and especially when you come back, kids at home, you're
Yeah.
like scared, you're infecting, and I don't really go outside to, even like just step out, just come work and come home. My husband does all the
Yeah.
shopping or meet friends or something. I just don't do that. But yeah, it was a little scary,
Yeah.
but
So have you come across COVID patients like, in screening or other ways?
yeah. So, as I said before, I work in Roger Williams Hospital, so I did the
Yeah.
screening and also the staffing issue. That is one of the biggest issue, like everyone facing, because they have to increase the bed, for the ICUs. So I'm not an ICU nurse, but they needed help in ICU.
Yeah.
So
Everybody
they
has to
started
get in. Yeah.
yeah, they started floating people. So they sent me to help them. So, like when they're in the, incubators, they have to be dressed up so they cannot come out and then go. So the ICUs will have like ICU nurse and also like a float nurse, like, they're like a flowing nurse, so will help, when they go in, like mixing medications, getting everything's ready because they cannot come outside because
Like the
the patients
supportive
are on like
efforts. Yeah.
ventilators. Yes, the patients on ventilators, and there'll be a lot of drips going, and then you need labs. There are a lot of things. So they were just there helping, and that is like that's really horrible because wearing the PPE, the
Yeah.
full PPE. Big, now I work in outpatient, so I have to wear only the mask. Only if we have any patients like corona positives, then we have to wear like N95 and a face shield. But working in the ICU with the patients, they have to wear proper PPE, full gowns, N95 mask, and face shield, and head covers and shoe covers. And being in that for 8 hours, like 12 hours, it's
It's a
really,
big deal.
it's and some of the I know like I didn't get any like I see like nurses getting like rashes,
Yeah. Yeah.
skin
Yeah. No, it's
problems
really
and all
tough.
those
I
for
mean, it's
wearing because the
very
N95 mask is so tight. Yeah.
yeah, it's remarkable to see people wearing those for many, many hours at a stretch and helping people and saving people. As in this profession, of course, we take a vow, we take a oath to help all the, sick people. But,
Yeah.
we also have families. So it's amazing how all the nurses, including you, are still going to work. You especially in oncology field, trying to ensure the patients are safe because they can
Yes.
get sick. Um, where does that motivation come from? Like, how does it say, like, even with the scare that you want to go get up and go?
No, I think, like actually when I was studying, I never once you started working with patients, you start to see them getting better, and especially in the cancer, this is really amazing. Like I don't know, like when you see the patients getting better, and then when they bless you, when they see you, and then sometimes you don't really do much. You may be little done like few things, but the blessings or the words you get from the patients, and then from the families, are that is really amazing. And
So
then
tell
that's
me
I think
any
that's
any
motivating.
tell me any unique story that touched you the most. Tell me something that touched your heart.
See, there are really a lot of stories, but I'll try to remember. Like since like see, even when you asked about the COVID patients, because since recently we had like few patients positive, and but we told them we put them in a separate room. So it's a leukemia patient actually, acute lymphocytic leukemia ALL. The patient, they get relapse, and then they recover and then they relapse. So 1 year back, the patient doesn't have any family member. I think she's not married, she's single, and she has like brothers, sisters. So she went for a transplant, bone marrow transplant, and then she did fine. So 1 year, and they have to come for maintenance therapy. So she did really fine, very good. And then one day, her platelets count started dropping. So that's the first sign we see. When the count's dropping, the first thing was the platelets count was dropped. So she was like really, but sometimes we thought it's a viral or something. Sometimes they can have some viral attack or something. Sometimes their counts come, then they go back. And then when she heard that, she was crying. And sometimes I'm an Indian nurse, but sometimes with culturally, I'm saying I feel more pity for them. But sometimes I may not be able to more because they hug. Like, I hug too, but sometimes it's not doesn't come automatically. I if anybody is upset, I I think they should be kept like alone or something. But sometimes it's different, so we have to be with them. So, and she cried, and then I just kept, I gave her a moment. Then I went back to her. because they have a really good trusting relationship with us because we traveled with them through them since the diagnosis. And I told her, okay, listen, so I know it just happened, so we have to take it because there are some difficult times you have to go through to get better. So this should be one of your difficult times. So let's see, I know you get back. Maybe we have to wait and see. Maybe it may come down, like, next week or something. And they did the biopsy and then she relapsed. And but then my doctor was so great. We like, okay, we are going to start your treatment again. And then, I think it's just the moment she was so upset. And then she like, okay, I have to
Got
fight.
up and said, I have to fight it.
I have
Yeah.
to fight. And then she really and now it's just 1 year back.
Wow.
And now she's with me and then she's in remission. That was really amazing. There are, like, I'm just saying, and then there's really some sad stories too. There are some sad, but finally the family is like so happy, and then they are
Yeah.
happy for us. Even they're not making through, they're happy that we did something. Make them comfortable at the end.
So any story with COVID related, like any patients or anything that touched you, or
So yes, this just happened like yesterday. This patient comes like every week for injections, MDS, and possible transfusions. So the wife works in the nursing home. She's positive, and the patient has to get injection every week. So he's not that much symptomatic. He's okay with that number. But if he doesn't get the injections, we don't know. He
Oh
may.
my God.
So since the wife was positive, them come now, but I know he's negative now. Sorry, he's positive. So
Is he positive, you said?
yeah,
He's
like
okay.
tested again because we cannot let them come in. So so it's in the I think we didn't make any decisions. So yeah, we have to. I think we'll bring him back. I'm not sure. It just happened because I was
Sure. But
he
all
needs
these
to
challenges.
visit for every 3 years. I've been treating him for 3 years. So he's like he cries like a baby.
Family. It's like family. Yeah.
And now it's like with this situation, it's really hard for him. So we need to discuss about this more. But this is just happened. Since you
It's
asked
very
me,
tough.
this happened.
I think having known patients for so long and then you realize that they're dealing with something different, worse sometimes, or maybe
Yeah.
similar to cancer, it's very, very tough. First of all, I want to thank you for all the great work you do, with all the risk you are taking and trying to save other people's lives, like especially cancer patients. So it's an amazing thing, an amazing selfless work you're doing. Before we go, do you want to say something to the viewers?
Yeah. So I know this is a tough situation. So everybody's, we hope this storm will pass, but we don't know when, but definitely it will pass. There is a, end for any problem solution. So we pray for that, we all will pray for that, and we just do whatever we are doing. So I know they are lifting, the like they are trying to
Social
reopen
distancing,
the
yeah.
economic, but still it's everyone just follow the mask, hand washing, very important, and then the social distancing.
No, Rama, thank you so much. Thank you for doing such a good, wonderful work, and thank you for being so selfless. We are really honored for you to come here, and we salute you for all the great work you do. So take care of yourself and be safe. And to my viewers, be safe, stay strong, and practice social distancing. Thank you, Rama. Good night.
Thank you very much.
Bye.
Bye.